The goal of the Oregon POLST Coalition in creating this video is to both share new protocols, innovations, and to also enhance existing protocols and innovation in the context of COVID-19. Before we share new information, we all remember who POLST is for. It's for people with advanced illness and frailty. It's not for healthy people. Oregon has a long history of sharing, of collaborating, of sharing information in the best interests of patients across competing health systems all over our state. The coalition came together in the early 1990s, and we launched POLST statewide in 1995. We have a quarter-century history of collaboration and sharing, and all of the innovations shared in this video can be used all across Oregon. Some of the innovations can't be used in other states because of restrictions on their form or because of regulations or statutes that will not allow some of these innovations to be used. Anything that can be used, we welcome being shared. A reminder that POLST, our goal is to assure that patient wishes are carefully elicited, accurately recorded, and honored in a time of need. That the POLST program is entirely voluntary. No one has to have a POLST form, not based on any particular age. It can't be a requirement of care. And increased vigilance is needed in this time period to assure appropriate care of those with disabilities. A document is available on the Oregon POLST website that talks about the care of persons with disabilities. It was developed in November and is of substantial use at this time. Oregon has found that OneClick access to the POLST form from the patient header is valuable. More attention is being given in the pandemic to being sure that POLST forms can be located in a time of crisis. This demonstrates a POLST form on the header with one-click access to seeing the form. In health systems with bidirectional access to the registry, not only are forms seen in that health system, but in any health system within the state that has been submitted to the registry. More details are available at the Oregon POLST Policies and Standards page. OHSU has published a trauma protocol for looking up POLST forms consistently on patients arriving at our Level 1 trauma program. A social worker is assigned to every trauma patient, and the social worker looks up the POLST form as soon as the patient's identity is confirmed and shares it with the trauma chief. This system works well when a social worker is assigned to the patient, but social workers aren't assigned to everyone, and people are working hard across health systems to find ways to identify POLST forms in others arriving who are not trauma patients. A number of health systems have chosen the age 80 to look to see if the patient has a POLST form. Others have added also looking for patients who come in with a packet suggesting they have come from a facility. And others have also added looking up POLST forms for those in extremis. Who checks for the POLST form in these protocols varies by health system. Some use the social worker at least part of the time. Others use emergency department registration staff. And some use the charge nurse to fill this function and relay the information to the attending physician. One health system, long before the pandemic, had embedded a social worker in the emergency department working weekdays. The social worker is a palliative care social worker and facilitates goals of care conversations with those who do not have a POLST form as well. A whole new way of looking for POLST forms is to move to the outpatient setting and encourage changes in nursing triage protocols for those who are calling with respiratory symptoms and who medically would otherwise be told to go to the emergency department. They are now referred, if they have a POLST form with comfort measures only, to palliative care or the primary care physician for that patient, and efforts are made to help support the patient at home if that's what they want. They may be enrolled quickly in home health or hospice, and other resources to assure their comfort at home are being arranged in new ways. We are finding substantial advantages in the pandemic to the changes made in early 2019 to the Oregon POLST form. For example, taking the pink out of the middle of the form when there is a need for scanning and faxing, readability is much improved. We removed Section C from the Oregon POLST form. That was about artificial nutrition and hydration. Prior to the pandemic, we received substantial endorsement for removal of the form. Emergency medical services never consults this section in the field and formally endorsed its removal. But geriatrics, family medicine, and hospice all have formal endorsements that can be seen on the policy page. In the face of the corona pandemic, with increased virtual visits and completing POLST forms more often over the phone, not having this section, which often has little relevance to the COVID pandemic, has also been praised by those completing POLST forms in Oregon at this time. Also, it is easier to complete the Oregon POLST form because we do not have a requirement for a surrogate signature when POLST forms are being completed virtually. Informed consent is important to all of us, and we want to be sure that patients and their surrogates truly understand decisions that are being made in a shared decision-making process, and documentation of the conversation and who it's with should be in the medical record. We have found that patients sign consent forms, and it doesn't guarantee that informed consent has taken place. We also know that surrogates sometimes carry a very heavy burden of making decisions about life-sustaining treatment. in behalf of a loved one. For some, the burden is increased by having to actually sign the order. Oregon has never required the signature, but now with virtual visits, the logistics of obtaining a surrogate signature in some circumstances are made much easier by not having this as a requirement, but assuring appropriate documentation takes place remains as important as ever in this shared decision-making process. The Oregon POLST Registry is a repository of POLST forms for Oregonians. The registry has been in operation since 2009. A majority of Oregonians, by the time they die, have completed a POLST form, and most have POLST forms in the registry. POLST forms are particularly common in those with advanced illness and frailty, particularly those of advanced age with comorbid conditions, those at highest risk of doing poorly in the pandemic. The registry serves as a 24/7 backup system if the POLST form cannot be found. To assure that the POLST form is accurate as entered, a confirmation packet is mailed to patients. It contains educational information and a summary of everything that was entered and how to make corrections if there are errors. This is one of many activities of the Oregon POLST Registry that improve quality assurance. During the pandemic, the POLST Registry is fully operational, sending out packets and entering POLST forms in a very timely way. The registry reports that POLST form submissions during the pandemic are down about 15 to 20%. The registry will have some exciting news for us this fall. There is a major rebuild of the POLST Registry underway. There will be improved access, and there will be improved quality assurance activities that will further benefit the POLST program. Here's an example of the quality assurance activities conducted by the Oregon POLST Registry. This is a report of the percent of people on the top line who have orders submitted to the Oregon POLST Registry by year for yes to CPR. In the annual report, this shows a steady rise up through 2017 in the frequency of yes to CPR on POLST forms. Many of these people should have an advance directive rather than a POLST because they are too healthy. We can see significant improvement in the quality assurance activities, resulting in a reduction of the use of POLST in those who are too healthy through 2019. And quality assurance activities will continue through the registry and through the time of the pandemic. New educational materials have been developed. This one is for patients and their families. POLST and the coronavirus. If you get sick, will your orders match your wishes? The goal is to be sure that people review their POLST forms in the context of the pandemic. And One Health System is reaching out to all of those with a POLST form at a time when they're not sick, and reviewing the POLST form by sharing this video and then having primary care or a care coordinator follow up with a virtual visit to be sure the POLST form is indeed aligned with the person's wishes. Another health system has made an additional innovation and is taking all of its advanced directives forms and having the surrogate name and contact information added to the Advanced Care Planning tab in Epic, so that the surrogate can be found more quickly in a crisis. Oregon allows verbal orders, but people may not realize they are available or how useful they are in the context of the pandemic. Electronic signatures are valid on a POLST form, and verbal orders following standard verbal order protocols are also valid. Emergency Medical Services respects POLST forms signed with verbal orders, and the Oregon POLST Registry accepts them. These can be very helpful in a time of increased virtual visits and phone communication. Another place where policy interest has increased is patients who are cared for in the hospital have new do not resuscitate orders and are about to be discharged. Sometimes leave without being offered the opportunity to complete a POLST form. Systems are in place for those going to a facility who have had a do not resuscitate order as part of facility discharge orders to remind the completion of a POLST form for those who wish to continue to be do not resuscitate. Trigger mechanisms are being developed for those who are being discharged home or a home-like setting to remember to offer the opportunity to complete POLST. 2 new videos have been created by Dr. Katie Stowers. They're 5 minutes each. One demonstrates a POLST conversation for emergency department physicians with a capable patient who has a POLST form. And the other demonstrates a conversation for emergency physicians with a surrogate of a patient who has a POLST form. We have gathered the information we could find. Things are changing rapidly, and it's not complete. We welcome the opportunity to continue to share through the Oregon POLST Coalition Quality Committee, and we express gratitude to everyone who so freely shared their organization's innovations to benefit all of those that we serve. We also thank all of those who have helped to fund the Oregon POLST program, and we encourage you to visit the COVID page on the Oregon POLST website at oregonpolst.org.